Okay, let's discuss briefly this top left section of the chart. This section touches base on why compromised airways are becoming so prevalent, especially in first world countries, because underdeveloped dental arches and jaws are much more prevalent in first world countries than third world countries. And that doesn't seem like it should be the case, but why is that the case? The answer to that question will be answered by covering the following topics: breastfeeding, diet, and oral habits. And I think it's good to go over these because they are topics that my assistants talk about with parents during a Healthy Start exam, and for good reason. Research has shown that babies who are breastfed have greater orofacial muscle activity than those who are bottle fed, and this orofacial muscle workout helps to develop good bony jaw structures. Orofacial is just a fancy way of saying the structures of the mouth and the face. In fact, there is evidence suggesting that the muscle strength that is developed persists. Even at the toddler age when breastfeeding has stopped, breastfed babies have stronger chewing muscles than their bottle-fed counterparts. An Australian study of more than 1,100 children found that children who were exclusively breastfed had better teeth and jaw alignment by the age of 5 years. Their risk of these problems was 72% lower than those who were not breastfed. Okay, let's move on to diet. The prevailing opinion used to be that teeth alignment and development of the jaws were purely genetically determined. But new evidence suggests that a soft or processed diet can help contribute to underdeveloped jaws and crooked teeth. Research shows that soft diets that is given to young children is not working the jawbones and muscles adequately enough. And instead of normal development with straight teeth, as is seen much more commonly in third world countries, we are seeing more prevalence of crooked teeth, misaligned bites, and underdeveloped jaws. Okay, so let's just read this infographic together about the dangers of thumb sucking. This is a poor oral habit. If thumb sucking persists after the primary teeth have erupted, it can change the growth patterns of the jaw and cause significant misalignment of the teeth. Okay, and you can see a picture of the open bite right next to the kid sucking their thumb. Okay, let's move on to pacifier. Research study done this year in 2018 shows evidence that the use of a pacifier is associated with anterior open bite and posterior cross bite, thus affecting the development of the orofacial structures. So both of these habits can be detrimental to your child. So if they have these, then I would recommend quitting them as soon as possible.